The patients we see here at Tenwick oftentimes come very sick. Sometimes they have very complicated medical problems and have sought healthcare at many different facilities and have been referred here finally. And they come for our expertise and in treating them and in diagnosing them sometimes. We also see many children who are more local and have some of the more common problems of childhood, whether that's something like a breathing infection like bronchiolitis, or maybe they're born and they develop jaundice, or develop GE and have vomiting and diarrhea and need some rehydration and resuscitation from us. Introducing Faith Aid's compassionate funds to the pediatric service has really been revolutionary.
Sometimes the mom has no milk, absolutely no milk, and she has no money to buy naan, which is formula for the child, because it's very expensive. And Faith Aid steps in and buys this for the mother so that the mother is able to feed the child, so that the child does not get malnutrition. That's just an example. They do that for us so many times.
Earlier last month, we admitted a child who was newly diagnosed with severe rheumatic heart disease, which unfortunately is a very common problem in Sub-Saharan Africa. She, like many children, had sought care in many places and finally was able to come here and receive that diagnosis. And in fact, she was critically ill when she presented. And we were not sure whether she would actually be able to survive her hospitalization. But by the grace of God and with the assistance of our cardiologists, we were able to help manage her rheumatic heart disease and her heart failure symptoms such that she was able to be ready for discharge. Her family had exhausted their funds trying to seek care for her in other places. And so at the time of discharge, Faith Aid was able to come in and assess the family's need, and we were able to help clear her bill and to be able to get her back home with her family, which was a real joy. I think for many reasons, we saw the grace of God in many ways in her care.
Faith Aid has been instrumental in Tenwick, and I would say personally for me, Brenda, knowing Faith Aid is like I have the backing of Faith Aid. I'm able to give the best care to the children, which I think is the whole purpose of us being here.
We so appreciate everyone who donates to the Pediatric Compassionate Fund. Whether it's being able to expedite care and get children the care that they need as fast as they need it, or being able to return children back to their home communities after a long hospitalization, the impact of the donations is just more than I think the donors can really imagine.